My first follow-up is usually with my physician assistant at about 2 weeks after surgery. And then after that, we'll see him another month later, so at about 6 weeks. And then if we need to, we'll see him about 10 weeks later. Patients that do really well, they come in at 2 weeks without a walking aid and almost looking like we haven't done anything to them. And then usually those type patients at 6 weeks, I kind of let them start getting back into life. People that are struggling a little bit longer, we'll see them in more regular follow-ups and sometimes up to 4 to 6 months afterwards to make sure that they're progressing, gaining strength, and getting back to where they want to be. A big part of what you're going to experience after a hip replacement is stiffness, weakness, and deconditioning. And if you're not doing your therapy, working on trying to learn to walk normal again and stretch out your joint and get that strength back, your recovery will be set back to a degree. And it can, for some patients, weeks to months. I always tell patients, hey, I can't make you normal. I can make you better, right? A hip replacement isn't really normal. It's not a normal joint. It's a prosthetic fake joint, and my goal is to get you back to as near normal as possible. I've had patients return back to golf and hiking within 4 to 6 weeks. When I look at my patients, the people that do formal physical therapy, they bounce back quicker. And that's what people want in today's society. And so if you want to get fast results with a hip replacement, you need to help me help you get there. When I sign somebody up for surgery, I'm committing to them to do my best for them, and I'm hoping that they'll commit back to me that they're going to do their very best to follow my instructions so that they can get to where they want to be as fast as possible. So we have somebody that's on call 24 hours a day, 7 days a week. And so if you call the clinic during regular clinic hours, you'll get my medical assistant. After hours, you'll get the person that's on call. If it's in the middle of the night and we can kind of bed you down and then see you in clinic the next morning, that's great. My work email is on my business card, and I tell my patients, this is your lifeline. If you can't get a hold of anybody else, email me, and that goes to my cell phone. Hip replacements can drastically affect people's life, get rid of pain and return function to get you back to the things you want to do that really gives you what people consider as a quality of life.